Let's go back to Dr. Fagbemi, and he is going to tell us a little bit about mesothelioma, and then we'll present the second patient that we're going to discuss this evening.
The next case we're going to be discussing is another uncommon malignancy, malignant mesothelioma. Again, estimated number of new cases for the year 2008 in the United States is 2,200 cases. In this instance, most cases are in the pleural cavity. Our patient presented with an abdominal variety. It's interesting that malignant mesothelioma is experiencing an increased incidence over the last decades in the United States. A number of factors has been adduced. Exposure in the workplace is probably one of them. It also is a malignancy where risk factor to its development has been identified, particularly asbestos exposure. But also noted is the risk of exposure of developing mesothelioma after radiation exposure. The diagnosis of mesothelioma is quite difficult. It's based on an adequate biopsy of a material. The biopsy will be directed by a patient's presentation in terms of symptoms, which will be elucidated in the history, as well as physical examination. Radiological studies will direct where to biopsy and what to biopsy. It also helps us to define whether the disease is locally advanced or systemic in nature. And this will include cross-sectional imaging with CT. A PET CT helps to identify disease outside an immediate area of interest. In deciding what to do to a patient in terms of treatment, what is important is the patient's stage as well as the pattern of involvement. It is also important to define the patient's ability to tolerate the treatments that are going to be offered. For patients who present with disease that is local, resection is the option that is recommended, whether it's in the chest or in the abdomen. Sometimes the resection is accompanied by other modalities. Radiation therapy can also be offered to a patient who presents with local disease or locally advanced disease. For patients who have systemic disease, the only option would be one of palliation using systemic therapy. It is important to know that systemic therapy for mesothelioma is not very efficacious. There are a number of reasons why. One of those reasons is the fact that there's such a paucity of cases that enough experience is difficult to gather in being able to develop an effective type of treatment. Nevertheless, there are a number of agents that have been used and that have some utility, including hormonal agents, again tamoxifen, or regular cytotoxic chemotherapy such as cisplatin or pemetrexate or doxorubicin. Immune therapy is also sometimes used, or a combination of these agents. Our patient this evening is a 50-year-old gentleman whose past history was significant for sleep apnea. He was also a smoker, but did not have any known asbestos exposure. He presented with a recent history of abdominal distension and abdominal pain. An ultrasound that was done as part of his initial evaluation noted that he had ascites. He underwent a paracentesis of his ascitic fluid, which unfortunately was non-diagnostic. Eventually, the gentleman underwent an exploratory laparotomy whereby a number of multiple masses were noted in his abdomen. The pathology report was consistent with mesothelioma. At this point, it was recommended that he undergo a regional therapy